All right. All right, let's start. It's 2:45. Well, Happy New Year, everybody. So this is Toki from MM Medical. So I am the creator of joint reduction task trainers. Uh, if you are a healthcare provider specialized in ortho or emergency medicine or athletic training, uh, you're gonna see, dislocated joint on the site. And you go to the conference, you participate in a reduction technique conference. It's only lecture only, there's no hands-on, okay? There's no way to practice reduction technique. Well, that's the problem. So I came up with this solution. So this is finger dislocation simulator. It can simulate finger dislocation. Okay, so this is the middle finger. Okay, let's say you're playing basketball. Ball hit this side and this bone come on top like this. Okay, did this happen? Yes. And you have to fix it. Well, you might go to the emergency room and you assume, the reason you go there because you assume the emergency room doctor, they know how to reduce this problem, right? Dislocated finger. Well, the fact is, there's no way to practice. So they're waiting for you to come so they can practice on you. And then even though you let them practice, you have to pay for it. I think it's the other way around, right? But anyway, so this is the finger dislocation simulator. And you have to push and pull. If you do that, snaps, okay? Again, dislocate it, okay? Okay, so just think about your hand, middle finger, this bone, dislocate, get on top, like this, okay? Push and pull, snaps. And you can do as many as you want. Tension is adjustable, like this one, so you can make it harder, easier, okay? And you can do both. Actually, you can do, this is called dorsal, okay? And this is a common one, but also you can do bowler, this side, okay? Push and pull, and little, snaps back, and as many as you want, okay? So this is the first one. Next one is elbow, okay? Okay, so Jiu-Jitsu is very popular in San Antonio, Texas now, and there's a tournament all the time on the weekends. It's just crazy. And I really think elbow dislocation is really, happening all the time. Okay, so dislocation. Okay, like think about you are losing your balance and you're trying to catch yourself, and then boom, dislocated. Okay, all right. So people make a comment about reduction. This is reduction technique task trainer. You will learn how to, hold the certain body parts, and then you want to do little extension, okay, and then traction down, okay. If you achieve that, go back in, okay. How you doing? Hello. Hi. How you doing? Hello, 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 people. Okay. So again, this is the elbow dislocation simulator. Okay. Okay. So this is the face down technique. Think about patient is on the exam table, facing down, and the elbow is hanging. Okay, like this. Okay. All right, like this. So what you want to do is just a little extension, okay, and then traction down. All right. What can I do for two bulging discs? Disc, well, I mean, I don't know how bad it is. You need to do physical therapy. Okay, this is the elbow, okay, model. So this can recreate elbow dislocation. Okay, And if you have this one, okay, then somehow you usually go to emergency room, okay, and you assume those doctors they know how to put it back, okay. Shoulder, it coming. Next one is shoulder. So you assume they know how to do it. No, they're waiting for you to come. So the ER doctor, they can practice on you, okay? And then you have to pay for it, even though you let them practice, okay? There is no way to practice, okay? So that's the problem, and I came up with this solution, okay? So this is the elbow dislocation simulator. It's a task trainer. You have to learn how to position, how to hold certain body parts, and you have to push and pull. Seriously, you have to push and pull, then you achieve reduction. Okay, all right. Tension is adjustable, so you can make it really hard, or initially you might you lose one, so you can practice technique wise, and then make it harder. Just be realistic. Okay, elbow dislocation, push and pull, or this is the patient on the exam table. Okay, a little extension and pull down. Okay, all right, as we have a request, let's do shoulder. Okay, this is the shoulder model. Let's think about this is the left shoulder model, and patient is on the exam table facing up. So we have the other model to show. So it's the exact same model, but this one without the skin, okay? So I show you, this is normal setting, it's on the joint. Now it's dislocated. I think if you know anatomical structure, it's dislocated anterior to the front, okay? All right? So it's happening on this one right now, okay? So this is, I think, zero position technique. So it's kind of modified, okay? So you wanna do is from here, you wanna come to 90, okay? How you gonna do that? Use your hip and elbow, squeeze patient's forearm, okay? You're gonna make, so your body and patient's arm is in one piece. So you shift your weight, when you get here, okay? Push with the left hand and turn your hip, okay? If you do that, watch here, clunk, get released, okay? All right, got some common, what is that? How about shoulders? Okay, I got that. Can you tell for shoulder dislocation? Yes. This definitely deserves have. Mostly it's dumb. Oh man, but this actually. Thank you. Okay, again, it's dislocated. Okay, left shoulder. Okay. So you have to learn how to position yourself. Okay, and how to shift your weight, and then push and then lean back, and then here again. Watch. Clunk. Like actually human body, like shoulder dislocation. So my products are task trainers for orthopedic, emergency medicine doctors, athletic trainers, wilderness medicine, military personnel, medics, combat medics, corpsmen, now nurse practitioners, some nurse practitioner, they work for orthopedic clinic. So people still learning reduction technique. So actually clavicle has been dislocated from, hello. I had my hip replaced last week, no fun. All right, since you asked for hip, so I have a hip model actually, okay? Okay, so this is the hip dislocation simulator. Okay, so hip dislocation happen. Hold on, I'll get up with the. But getting better with the walker. I'm so glad I was knocked out today. Dislocated hip. Ooh, you got dislocated hip. Whew. All right, so dislocated hip happens like a car accident. Think about your, driver's side or seat, and then knee hit the dashboard, and your body goes forward. So hip dislocate to the back. Okay, happens, yes. And I don't know if you watched the ER drama called Pit, and the series 6, episode 6. I'm sorry. Exactly how it happened. Yeesh. Okay. All right. So this is the thing. You went to the emergency room, right, for hip dislocation, and then everybody assumed those doctors did practice, right, how to do it. No. Like I said on the ER drama Pit, episode 6, chief resident picked one of the resident and, and taught how to do it. Called Captain Morgan technique. Okay, Captain Morgan technique is, if you know a rum, Captain Morgan, he put his legs up on 90 degrees, and that's somebody named the technique as Captain Morgan technique. Okay, so what would you do is, let me see, this angle might be better. All right, so you bend the patient knee to 90. Okay, and you put your knee underneath. And then, just the physics, push toes down. That's how to put it back and dislocate the hip. Hit by a car from behind, and it turns my liver and my hip had to, yeah, that's usually, that's how it happened. Well, do that technique, one more technique. All right, let me see. All right. Okay. So, all right, so it's dislocated hip. The ball supposed to be, hold up. Let me see that. So the ball supposed to be here, but it's dislocated to the back. Okay? Okay? All right. So it's a Captain Morgan technique. Okay? Make it just, all right. So you put your knee underneath patient's knee. Okay? Okay, right here. Right? All right? And it's the physics. From that part, you push your toes down, this is gonna go up. Got it? Okay, my name is Toki Nakazawa. Wow, it's amazing. Is there any, hello. That's cool, thank you. My doctor must have done it right before I was working the next day. Yeah, but, sooner you reduce, it's easier. I feel like they broke my hip after that, but I can't say no more because I know, yeah. Well, I was told the ball came out of the socket clean, put it back in cover, cracked, so I had plate and screws. But the plate was 20 years ago, and now, yeah. So let's get closer. Okay, so this should be normal, okay, in the socket. But think about, knees 90 degrees, let's say, just sit sitting position, and then car accident, knee that knee hit the dashboard and go dislocate it to the back. Okay. So, all right, it's dislocated. Okay, I'm just doing the technique and then just see how this thing is gonna go back in. Okay. So. Okay. So you're supposed to your knee by lifting up, but when you push down on their foot to shift the hip up. No. So usually somebody will holding down the hip. Okay. So this is a simulator, and you stepping down, you making the down force, so you can do everything by yourself in this situation. But usually, you know, if you push toes down, hip's gonna come up, so somebody need to hold it down this part. Okay, or emergency room, sometimes they have a strap on the hip, so you cannot come up. Okay. Come out the socket. Do you have to tie the patient down to the technique? Yeah, you need to tie down the patient, or somebody need to hold it down the hip so it will not come up. Yeah. Well, I just dislocated my shoulder 1 hour ago, still in the hospital, and it still go out right now, which is crazy. Okay, so, all right, I'm just suggesting if you're in the emergency room, which side is, let's say your right shoulder is dislocated, okay? Use your good hand, cross like that, and the same side of your knee, you dislocate it, put your knee in, okay? And then breathe nice and slow, trying to relax. Breathe in, out, and then lean back. And do that a couple times. It might go back in. Okay. All right, so this is your shoulder is dislocated 1 hour ago. Okay, so its shoulder is dislocated. So this is a technique the doctor might use. This is my technique. Okay, use your hip and elbow. Squeeze patient's forearm, make it one piece. Shift my weight and then lean back. Watch here. Clunk. So that's what's gonna do to you for the shoulder dislocation. So looks painful. It is painful, but needs to be reduced. Thank you for the info. Welcome. I was in a car accident, broke my hip, femur, and pelvis. Was ICU for 7 weeks. Ew, that's a bad deal. Jesus. I'm sorry to hear that. That's how it goes in. That's the hip, you mean? Yeah, that's how it's going back in. Where do your back and belly? I don't understand what you're asking. Hello. Dislocated shoulder for clavicular. I don't understand the question you're asking. What is that, sir? This is the task trainer. So your bodies sometimes dislocate certain body parts, like here, finger, dislocate, okay? Let's say you're playing basketball, ball hit the tip and this bone come on top, like this. Okay, and you go to the emergency room and they need to fix it, okay? Put it back in the right spot. So this one, you have to push and pull. If you do that, snaps. So it's task trainer. You will learn how to hold the certain body parts to achieve the clunk, okay? South Africa, wow, pretty far away. You're not a doctor. I'm not a doctor. I'm an athletic trainer, sports medicine. Okay. Hey, you. From Mexico, hola. Can you do this while the person is awake, coherent, or do you sedate it? So I used to work for high school setting, and if I see injury within 10, 20 minutes, 10 or 5, 10 minutes. So I'm not a doctor, so I cannot give any medication. So I will reduce it without any kind of medication. So. I am a video editor. I use Premiere Pro and After Effects software. I do not do. I have low back pain, so sorry to hear that. Wine years. Whoa, that's very neat, sir. Thank you. Truth 1404. Anything you can suggest about what? This is my brand. This is my business. I design, create medical simulation product, and also I teach classes. So I'm from Germany. My family, none of my family member. This is how you start over here in the United States. I'm from Germany. My family is and family members. Okay. I am, how old am I? I think 53. What's the other one that right behind you? This is a finger model, okay? And this is elbow model, dislocated, okay? So, let's think about patient is on the exam table, facing down, the elbow is on the edge of the table, like that, okay? So little extension, and then pull. If you do that, go back in. Okay, ankle injury, anything about healing? You mean ankle sprain? You gotta do a little rehab, and it takes time, okay? Tell me the people wants to, don't know what to do. The Herbie dashboard. I don't know what you mean. I dislocated my elbow like that. So maybe you are losing your balance. You're trying to catch yourself and dislocate, maybe. Okay. So posterior dislocation. So a couple of different techniques. Think about this could be ground and then push and pull. So, well, very neat. Thank you for showing and giving an example. No problem. Do you have a website? Yeah, I have a website. If you go to my YouTube channel page, I have a website, so you can go up there. Yeah. You can check out, if you go back, I have maybe 700 videos. Some are kind of same thing, but different people, different individuals doing it. So, what is your name? My name is Toki. How do you fix dislocated shoulder? All right, I can do it. Okay. So this is the shoulder model. So because of the camera, but this is the left shoulder model. Okay, I only had the left shoulder model. So, okay, it's dislocated, so I can show you this model. So it's the exact same model without the skin. So this is the where it's supposed to be in it, but it's out, dislocated to the front. Okay. All right. So different techniques. Okay. So one of the technique I show you now is use your left hand to push the chest, the side of the chest, okay? Use the other hand, hold the wrist, okay? And then push and pull, and also turn the exact, like a doorknob, turn the doorknob, extra rotation. So watch here, okay? Let me get closer, okay? If you do all together, clunk, go back in, okay? All right. Okay, hold up. Okay, hold up. Do-do-do-do. Why can't I do that? Hold up. You should go back. If you go back to the my YouTube channel, open another window, and then click to see the whole the description of the video. You should. Community moderator. Oh shoot! I don't know how to do that. Shoot! Hold up. www hold up. www.mn-medical.com. Yeah. All right. Okay, hold up. Man, so many questions. Let me get to it. How to fix the shoulder. How long does the pain last? The sooner reduce, you can, you will have less pain. Okay. I had broken my back 40 months ago and started to hear that. So scary. What's your experience with CPR of the upper extremity from a life trauma, and how do you manage it? You just gotta practice. Okay. Let me see again. All right. Sorry, I got so many messages. All right. So one more time. Let's do it. So this is the finger model. Okay. So finger dislocated. Okay. So think about let's say you're playing basketball, ball hit this tip and this bone come on top like that. Okay. So you have to push and pull to feel snap. Okay. Next one is the elbow. Okay. It's dislocated. I don't know if you see it. Okay. So, all right. Okay. So this is the patient's facing down on the exam table. Okay. Think about it. Okay. Patient is facing down on the table. The elbow is on the edge of the table. Okay. Little extension. Okay. And they pull down. And now it's in. How do you help with shoulder tendon snapping that causing pain of weightlifting? Rotate the calf exercise. Your website converting and bringing sales? Yeah. I was in the middle of the court, studying my finger, screaming. Yeah, I see it. Yeah, finger dislocated, snap. Hi, I told the MCL on the back of the recovery. Yeah. Okay. Shoulder model. Okay, so it's dislocated inside, and if you see here, if you push and pull, clunk. Okay. All right, let's do the hip. Okay. So this is the hip dislocation simulator. It's the left hip. Okay. No, I'm not Chinese, I'm Japanese. Okay, so this is hip dislocation, posterior. Okay, just imagine. Well, I hope you don't get in a car accident, but you're driving, and then you hit the wall. Okay, somehow your knee hit the dashboard, but your upper body goes forward. So your hip, the bone goes to the back. Okay. All right. So this technique called Captain Morgan technique. Okay, somebody named it. Some drunk healthcare provider named it. I didn't. I wish I did, but okay. So what you do is you put your knee underneath the patient's knee, and then physics. Okay, push your toes, push down the toes. Then this will come back up. Okay. All right. Watch here. So that's the Captain Morgan technique. Do you need website? No, I don't. That's what you're looking for. I don't know. Am I having left collarbone pain in the bone? Was nice. I don't know. I heard you were in North Korea. I'm in Texas. What are you talking about? I don't need the website redesign. Jesus. All right. One more time. Okay. So, can you crack the jaw like crack the jaw? What do you mean crack? Do you mean dislocate the jaw? So, this is jaw model. Okay. So now it's in the right place. Okay. I don't know if you can see it, but it can dislocate, come out to the front. Okay, I don't know if you can see it, it's a little off. Okay, it's not center. So that's the jaw dislocation. Okay, all right. Pakistan, whoa. Car accident was the passenger lying back flat and you were hitting and the drunk driver. I mean, a lot of things, happen, so. Sophia's, hello. My name is Toki. I was asking, does it take more muscle power to fix dislocated joint or actual patient than the module? So the longer it's out, it's going to be harder. Okay, let's say, individual dislocated finger. Okay, and if you reduce right away, it's easier. Okay, but if you wait for like 1 hour, it's going to be harder, even though it's the same patient. So that's why sooner reduce it's easier. Okay. Having the posterior knee pain broke my patellar tendon. I have to get on motor. So now, so it's my only viable option for now. Do you going to build the strength in that knee? Extension machine. Okay, knee extension, just nothing but squat. You can do that too. Well, So elbow model again, okay? So now dislocate it, it's out, okay? And this is a technique you can use, think about patient is already sitting down on the chair or something, and use the back side of it, and then push and pull. Okay, if you do that, now it's in. Okay. All right, do you need a website? How many times you asking this guy? I don't. No, I understand. I understand the model. It's same thing. Yeah. Do you have a thumb model? No, I don't have the thumb. Just the middle finger model. Yeah. Best way to solve a sore stomach. I don't know what to tell you. This is the show the Captain Morgan technique. Yes, I can do that. Okay. So it's dislocated. I don't know if you can see it. So it's not in a joint anymore. Okay. All right. So what you do is get your patient's knee to 90 degrees and you put your knee underneath. Okay. Let's get closer. Okay. And then push the toes down. Then so that's the Captain Morgan technique. Come again, hold up. There's so many questions. Best results, no. I did a Captain Morgan. Hello. Before the after one workout. Why don't you answer mine? What do you mean? What is the answer you're asking? I have no idea. Seems something useful. I will describe and watch later. Thank you. Do you need a website? No, Jesus. They wants to see the toes, how you pull them down. The camera needs to be moved. How long should be stretched? I have no. Okay, hold on. Let me see whole picture. Okay. All right. Okay. All right. Okay. Okay. So hip is dislocated to the posterior, to the back. Okay. All right. What you want to do is bring the patient's knee to 90 degrees, okay? And then you put your knee underneath. You put your knee underneath, okay? And then push the toes to the down. Then this will come up because the physics, okay? Okay. Why should you tighten? Bonjour, French people. I'm in Texas, still Texas. This is only channel that still have something to offer. Well, trying to. Are you a doctor? I'm not a doctor. I'm an athletic trainer. My left shoulder is hurting, especially in the shoulder girdle. Sorry to hear that. You're the best, man. Jesus love you. Okay, whatever. So basically, it's all about pulling the original. So, good point. So, if basic principle of reduction is over exaggerate what happened, okay? So, this, let's say this is the finger model, right? So, this hit the ball, then this one comes on top, okay? Like that. So, over exaggerate what happened and push and pull. Oh, thank you. Appreciate it. Okay. Could you show the technique for relocating a kneecap? All right, kneecap. Okay. Actually, kneecap is pretty simple. Okay. So let me see. Get to this angle. Okay. So kneecap usually is dislocated out to the outside of your knee. Okay. So what you want to do is hold the kneecap, open it up a little bit, and then make it straight. And usually, if you go make it straight, it will come back in. Okay. Yeah. All right. And if your back has a shock, I don't know what's that mean. 你好，你好吗？ Elbow dislocation. Okay, push and pull. Okay, you can do as many as you want. Okay, this tension is adjustable. Okay, and this is for the emergency room doctors, orthopedic doctors, athletic trainers. Actually, for a lot of healthcare providers who benefit this because there's no way to practice. That's why people usually they don't even try. Okay. Do you work with professional athlete? No, I used to work for high school settings, so just high school kids. Hello. All right. Let's do hip again. All right. So this is hip dislocation simulator. Okay. So just think about. I hope you don't get in a car accident, but you might get in a car accident, and then your knee hit the dashboard, and your body goes forward. So this big bone goes back, and dislocation happens. Okay. And if that happens, you usually go to the emergency room, right? And then you assume those doctors they practice how to put it back. No, they're waiting for you to come so they can practice on you, and you have to pay for it, even though you let them practice. Okay, that's the fact. Okay, so this technique called Captain Morgan technique. Okay, put your patient's knee to 90. And then you put your knee underneath patient's knee, okay? And then it's a physics. If you put the toes down, this is gonna come back up. So that's the Captain Morgan technique. It's pretty brutal technique, but it's smart technique in my opinion, so yeah. All right, anybody got a question, anything? You want to see it again? If it's not, I'll be done. So, all right. Ni hao ma. Oh shit. Thank you. All right, I guess that's it, huh? Anybody got a question? What about ankle? Okay, all right. I have the ankle model. Okay, so this is the left ankle because the camera maybe you see different, but so this is the left. Okay, you step on something and then you dislocate. This happens all the time. So all right, hold up. You go back. Go back. What about ankle? Yeah. So usually you just hold the heel and toes, okay, and then just pull, nice gentle, and if everything is still intact, which means the bone is still good, and just ligament is might have some minor damage, and they want to go back into the original space anyway, so you will go back in. Okay. How many times we calisthenic? I don't know. You gotta ask somebody else. Does ever hand dislocate? You mean finger or hand? I don't understand the question quietly. We're starting out. Try again for all those info. Have a great rest of your day and weekend. You too. From India. More. Why my knee gets inflamed? I don't know, different things. You're out of shape. You have a meniscus tear inside. Depends. My ankle heel was forward. How can I go? This English is no good. That's all right. Can I see technique how to get the hip bone back in? You mean the which one? Hip dislocation? This one? I was asking for hand one. If shoulder is frozen, what should you recommend? A lot of stretch, medication. Okay. How to break a bone, a single punch. Say yes. Hey, hi. How would you from me? How you doing? I'm in state of Texas. Okay. So I'm gonna do everything one more time, and then we'll be it. Okay. So finger dislocation. Okay. So think about playing basketball. You're trying to get the ball hit this part, and this won't come off like that. Okay. So and you have to do is just push and pull, snaps. Okay. This elbow. Okay. All right. So this is the patient on the exam table facing down. Okay, what you want to do is just a little extension and then pull down. Okay. Okay. This is the shoulder model. Okay. This has skin, so you cannot see if it's dislocated or not, but it is dislocated right now. And then you're gonna do this technique of push and pull, and then little external rotation. Watch here. Went back in. Okay, you have to use actual traction. Okay. All right. Wrist dislocation. So usually they break the bone right here. So it's not a wrist dislocation, it's a fracture. Okay, young age, they have a growth plate, so it's called Colles fracture. So that's a bad deal. You have to go to the surgery. Okay. Hello. is it? Lucian, how about you? Okay, again, finger dislocation, push and pull. Please tell me my heel pain. Say please forward. I don't know what you mean. I'm Japanese. I'm Japanese, but I'm living in the state of Texas. So, all right. Okay. Okay. So this is the hip dislocation simulator. Okay. So if you get a dislocated hip, and doctor need to practice, but there's no way to practice. But I came up with this device. Okay. So it's dislocated now. So this is called a captain moment technique. Okay, you put your knee underneath patient's knee, and then physics. Okay. And push toes down. That's how you go back in. So, okay. I'm in the USA. I'm in Texas. And hello. Leg dislocation, hip dislocation. Okay. I like Japan. Oh, thank you. Goodbye, sir. It was very informative. Thank you for. Yeah, sure. Thank you. Massively painful? Yeah, you got to be. Well, I mean, usually if you go to the emergency room before this procedure, you'll be knocked out, so you don't know the pain. Please repeat the jaw joint. Yeah. So this is the jaw model, okay, TMJ, okay. So let's see, this side, this is in the right place. It's not in the right place. Supposed to be here, okay. But you can dislocate right here, okay. I don't know if you see it, it's not straight, okay. That's how they look like when you dislocate it, okay. And you can dislocate one side or both sides, okay. Mega Mind Skull. Well, yeah. Kind of. All right. Well, anything else? Think I'm done. So, all right. Thank you. Can you say, huh? What does that mean? So your phone ring. Okay. All right. That's it. Thank you. I'm a athletic trainer, like sports medicine. So I'm not a doctor. Okay. So, all right.